the Kern Valley Healthcare District Board of Directors meeting. Everybody is in attendance. So we have approval for the agenda, but first we're going to do the flag salute.
Okay, everybody would better for me. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And if you would care to join me, Heavenly Father, we just ask that you come be with us as we make decisions for the Kern Valley Healthcare District that would benefit our constituents in the valley and those who are visiting. We ask that you be with those that could not be here today and just bless them in their travels. Father, we just ask that you help us make trusted and good decisions for the healthcare district in Jesus' name. Amen.
The mission statement is we will provide high quality, efficient patient care services that we respond to community and provider needs. We will provide leadership in the healthcare promotion and education for our patients, residents, medical staff, employees, and community throughout the district. Now is the time, if there's anybody from the public, to have public comment. This portion of the meeting is reserved for persons to address the board on any matter not on this agenda, but under jurisdiction of the board. They may ask a question for clarification, make a referral to staff for factual information, or request staff to report back to the board at a later meeting. Also, the board may take action to direct the staff to place a matter of business on a future agenda. The board cannot take action on items not listed on the agenda for action. Speakers are limited to 3 minutes. Please state your name before any comments. I do not see anyone here from the public that wishes to make any comments. So now we're going to go to the consent agenda. The following items are considered routine and not controversial by the hospital staff. Consent items are listed as action items and may be approved by one motion if no member of the board or audience wishes to comment or ask questions. If comment or discussion is desired, the item will be removed from the consent agenda and will be considered separately.
Okay, on the contracts, that's on the consent, I think. And I'd like to talk about that. One thing we talked about a little bit is that CYRANO rental system.
Mm-hmm.
Hey, Catherine,
Yes.
forgive me. We still need to approve the agenda.
Oh, you're forgiven.
Thank you.
Thank you guys for going right along with me.
That's so confident.
I know I did. Since Fred's not here, so if I can have approval of the agenda. Fred, your vote.
First, I believe Jean wants to remove one item from agenda to discuss it later.
We're in the process of doing that.
Well, that's what I thought.
No,
Yeah,
but
we're-
it's
We
the
haven't approved.
full, not the consent agenda.
Right, the full agenda.
Yeah.
Okay.
Right.
So you need
Oh,
a
okay.
motion and a second to
We need a
approve.
motion. I'll gladly motion as such.
Okay, I'll second.
Okay, Fred, your vote?
Yes.
Yes. Jean, your vote?
Can I vote twice?
Nope,
Yes.
not today. John,
Yes.
Ross,
Yes.
and I'm a yes. Okay, Jean. So you would like to have something removed, or you?
Yes, that Crano, is that how you would? say it?
Cyrano.
Fair enough. Okay, well, I was
Where's
going
it
to
at?
pick off. Contract, I'd like to talk about that. Take it, it's on the, under contracts.
But we're going to move that to new business?
I don't know, I just want to talk about it.
Okay.
So,
That would be number 2.
and then the other thing, I get confused and thanks for Fred being up there and keeping us on track. But the local pages, we discussed that. Debbie wasn't here at the finance committee meeting. And it's the most ridiculous thing I've ever heard about. Somebody's paying money to be in the local pages. Nobody, do they even have a phone book anymore?
So what item is that on consent that you're bringing up?
It was on, where was that at? It wasn't contracts, it was on, our girl's not here.
I don't see it on here, Gene. Can you help direct me so I can find it for you?
On
It
contracts,
was on
Page 7.
review for last month, so it was approved at last month's board meeting, but it was on the consent agenda for last month.
okay, okay, well, I'll bring it up next time. Okay. Then that's it.
Thank you.
So we're moving this year now to new business.
Yes, to number 2, please. Okay, so we're going to approve it with the changes and it moved to new business. And so,
So motion to approve consent, except for item 7D. Second.
thank you. Fred, your vote?
Yes.
Jean, your vote?
That's,
John?
Yes.
You guys are fast. Ross?
Yes.
And I'm a yes. Thank you. So we're gonna go to, the recommendations, pages 5 and 9 of the board directors meeting minutes.
Go right to Tim.
Oh, because I thought it said,
But that's all.
actually, it was already approved. Sorry, you're right. Hey, Jean. Tim, your report, please. All right, I'm going
Sorry, I'm
home.
not there to keep poking you with my finger, Kevin.
It's not enough.
can I have one of those drinks?
Lack of sleep, I'm telling you.
I believe it's those dogs.
It is those stops. I'm telling you, my husband's out of town, so it's those stops.
You got 100% of it.
Not selling them very well.
I have sold all but one. Unless you want it, oh, except for the, but yeah,
And they're all leaving them.
right, yeah.
Apparently lying
Takes
next
good
is
care of
what
it.
we've heard.
I'm not letting them go till they've had their shots. There you, I'm a responsible dog owner. My dog.
That's
Yeah.
great. Just some quick updates here. Well, I have reached out to the owners of the property next to our building down here, asking them if they would either consider donating or selling that to us. Put it in that order. So I'm waiting for that response back from them at this point in time. Like I said, I asked them if they'd had any plans, that they've developed for the property, and so forth. And, so I'm not anticipating that they will, but we'll see. Bob and I are looking at a issue right now, again, because I know it's come up before. I think, Gene, you raised it with regards to the showers in the acute unit and so forth. And so we're working on a plan right now to go back and upgrade all of the showers in there, putting new doors on. The tiling and everything looks good. We've looked at that. But they'll put all new code base in, they'll repaint the rooms, everything else.
Cool.
Some
What
new
the plumbing too?
They'll work on that too, yeah, because there's some issues there, like I said, with.
It's got in that stuff. It's gonna be fixed anyway.
Yeah.
He's gonna be replacing all the commodes with higher.
The higher,
more,
yeah,
more-
But the sinks the water wouldn't go down, so I know the nurses had trouble washing their hands.
yeah.
And so,
So, yeah, all that's gonna be taken care of. All that's gonna be taken care of. And the cost of that was running about 2,500 per restroom. And so because they're between 4 beds, it's about 17,000 total.
so we can do it ourselves though.
We're gonna do it ourselves.
Yeah.
Yep.
That's very, very cool.
Yeah.
Thank
So
you.
Bob's gonna get working on that. He's just finishing up finance down here, or not finance, but medical records. And then he'll start on this. So hopefully in the next couple of weeks, they'll be ready to go.
Cool.
So
Very, very cool.
the, just a couple of other agreements that we've just recently renegotiated with the Tri-West, which is the military one. That is going into effect January 1st. Blue Cross will be administering that product.
Is this the VA one?
This is but it's TRICARE. It's
TRICARE, it's what it is, TRICARE, which
it's regular. It's normal.
is a part of that, yes, for the retirees and stuff like that. So we got that approved. We got some good rates on that. Also, the ancillary service agreement we negotiated with Bakersfield Memorial Hospital, got some good improvements on that contract as well. We also renegotiated our new Houch and Blood Bank agreement for 2025. I think I mentioned at the last meeting that Dignity had reached out to us with regards to giving us a new stroke robot. That just arrived. As a matter of fact, just saw it on our way over here. We're pulling it into IT. So it's a brand new unit. And again, just keep that program going because this is a very valuable program to us. And so, but yeah, I'm glad that Dignity is taking an active interest in it and so forth and helping keep the equipment up to date and so forth. So,
And they update it about probably once every 18 months. They give us a whole new.
yeah,
They're about.
so works out really well. What else there? Just Bodfish property that came up last time. I actually got a note from the owner this morning, actually last night, 3 of them today, that he's interested in moving forward. He kind of liked the ideas that I put out for use of the property and so forth. I have some things I need to follow up with Scott on because he wants to talk about how we do transfer and stuff like this, and then the charitable nature of the organization. I think it's a tax issue that ultimately they want to make sure that they protect and so forth. So I told him that I would reach out to you, and if need be, then maybe we could have you draft up an agreement or something like that to do that. So he was okay with that.
Okay.
So that's moving forward. And then just wanted to give an update also on the Anthem issue. That, like I said, when we raised that up to the Andy Worker that got his contact involved with that, and Efren Medrano and so forth, and he lit a fire under a bunch of people and apparently sent a letter out to us saying that this was entirely their fault, that he had directed his staff to get on this immediately and get this thing fixed. But as we got into this, we found out it was a little bit more complicated than just sending out a letter. The issue was that their system apparently dropped the IPA data out of their system for Dr. Mongar and so forth. So we've had to reach out to all of the health plans and the IPAs group, and Marie's been doing that very quick. And I appreciate the effort she's put in on that.
What's IPA stand for?
Independent Physician Association.
Okay.
So, and so so we're getting that data back. Qualcare has already responded. Dignity is putting all the data together for us as well. I reached out to BFMC this morning. They are putting it together as well because they have delegated credentialing. They said we will fill it out and submit it directly into Anthem right away. So I'm waiting for a call back from Stacy Reeves.
Since this is Anthem's issue, can't they do that?
That's what I
They
asked.
don't have backups that they can't look at?
That's exactly what I asked, and apparently they know.
That's crap.
I'm saying that would be a huge hit to their network.
I know.
If something came in and deleted this stuff. I mean, and they still have no idea how this happened.
I still can't believe they don't have a backup somewhere.
Trust me, I put it right. Got it.
Wow.
But they're not deleted in any other IPAs or other.
No, it seems
Qualcare itself for anybody,
to be just
for Aetna, it didn't get dropped. It just got dropped in their computer.
correct. So anyways, we're having to help rebuild that.
Well, you'd think they would rebuild it. I mean, I'm not gonna agree with Russ, but.
Right. It's incredible. So, and I'm just pressing them. I'm calling them every other day, and telling them, I said, hey, where are we at? I want a status report. Again, our patients are complaining. I said, we need to know so we can get back to them and stuff like that. So it's
As a rule, Red Cross will pay better than anybody, as a rule.
Yeah.
They're really good company, but
you go through, it's tough to get anything done with them though. It's what we've found.
So has all this been communicated to the patients that it's been affected, like Mr. Jordan and?
I personally called Mr. Jordan and updated him on that. I've got one other family that I'm aware of that we're trying to get the contact information for that call get made. I think we've identified, was it 9 total that we know of. So I'm just trying to get the contact information. I'll be making personal calls to all. And so forth. But before I do that, I need to know when they plan on having this resolved. That's the problem. So,
I guess that's what immediately concerned me, because to have something like that affect all the patients that are on that plan and not being able to get services that they need, like
yes,
cancer treatment with Mr. Gordon's case.
there were some other cardiac issues apparently as well, so forth. So, yeah. So, yeah, that's what we've been leaning on. Just to listen, guys, this is affecting people, significantly affecting people's healthcare. So,
Can you keep us
yes,
as soon as?
absolutely. I'll do email and all. Yeah, absolutely.
And another question on Anthem.
Yeah.
Did what happened violate our contract with them? They somehow not fulfilled their responsibilities under contract, and should Scott send them a letter and saying, fix it now?
I'm more than happy to look at, again, those contracts are pretty good size. I will take a look at that. I'll look at
So,
that.
Tim, so it's clear, because most
Yeah.
people don't have a clue what I do a
Yeah.
little bit.
Sure.
Blue Cross has 4 or 5 IPAs, which is
Yeah.
the qual care and the ones he's just
GFMD,
referring
all
to.
the others, yeah.
Aetna has the same IPs underneath them. They all use the same group, not all of them, not the same group, but primarily, basically all.
It could be duplicated, probably.
Right, well,
Well, not because-
no, it's not. If
Okay.
they're okay with everybody,
Not
it's only them, so you're correct. They're responsible, it's their system that deleted it.
And they're at risk of losing those patients, obviously, because those patients are going to go someplace else to get care if they can't get to their physician.
Well, and they're gonna go someplace else besides here.
Yeah.
It's destroying our business
Sure.
too.
Absolutely. So, yeah, Scott and I can take a look at the contract and just see if there isn't something in there
And,
that we can take.
hold them financially responsible.
We can do that. We can do that. Yeah, I mean, any visits that we've lost as a result of that, scheduled
Absolutely.
patients and stuff like that.
And our reputation.
Well, and the patients, they had to find another place to go. And so
Horrible
that put them out of their,
Yeah.
I'm thinking maybe what really needs to happen is we need to do something, put it out to the newspapers or to, Facebook or whatever, explain the situation that this was truly an Anthem problem,
Let's
not
do that.
associated with the hospital. But Carrie, you probably want to get with that.
Well, is it better to do that or to identify the ones that were actually affected? 'Cause it sounds like the numbers might be a little bit smaller than a mass.
I still
Yeah,
think
it's
it,
not massive
yeah,
thousands.
I still think it'd be appropriate to put it out publicly.
Yes,
We had a
Right.
public comment
that we know.
during the
Yes.
Right.
last meeting,
It couldn't.
so it's in the public realm now. The
And I,
problem,
I also agree for the fact that, Carrie, even if it was just affecting one, if that one person speaks negatively to enough people, it spreads like a virus.
10,
Exactly.
10 till 20, 20 till 50.
Yeah.
Yeah.
So we'll do that. We'll
Figure
figure something out, just to update that on.
Just question, make sure we're,
yeah, it doesn't have to be an individual named in it, but identify the problem and how we're trying to get it fixed.
or if this has happened to you, contact.
Yeah.
That's a good point too. Yeah.
You know,
Very
because put it back on, at least we're aware of it. We let people know we're aware of it.
bet.
Because otherwise they call and they're like, oh, well, you're not
Why did
covered
you drop
anymore.
me?
They're like,
Yeah,
oh, I don't know. And some people won't follow up.
the ones we have plan on resolution, we can draft something like that. Would you?
I wouldn't
wait?
wait. No, I'd say, we know this is an ongoing problem. This has happened. If it's happened to you, let us know. We're trying to resolve it, but Anthem is dragging their feet.
Well, the other thing, I will use that as leverage with them because, again, we've told them this is the directive that they were given from their boss was get something out immediately. And that hasn't happened yet because they say they can't and so forth. So I said, fine, then I'm going to take that initiative and we're going to put something out. And you can just figure out how you're going to deal with the
Yeah.
people calling you afterwards, but.
Absolutely.
So, I think that's.
I don't think we have much option, guys.
Yeah, I agree.
And I'd put contact names and numbers in that public release to Anthem.
Hey, that's an idea.
What if we do the right thing like you guys are talking about doing?
Yeah.
And it improves our reputation, then
Good.
we might have to pay them for.
Oh, thanks.
More business.
Binder fee. I would caution that we don't use patient names though.
Yeah, no.
I wouldn't caution.
I'll talk-
They just-
Yeah, yeah. There's no need to do that. Yeah.
No, there's none, yeah. So. Hopefully.
Forgive me for stating
That
that.
happening, so. That happens, that's on them, so.
We'll figure out a plan.
CMS could have something to be involved that they can't change it because for whatever reason.
Right. So, and that really kind of the last thing, we've got one, we went December 18th, we have the Christmas luncheon here at the hospital. We're trying to maybe do it a little bit differently this year. Deb and I have talked to Carrie about the possibility of having whoever we cater the thing, have them serve it so that we can all sit down and enjoy the dinner.
You're doing that for me, aren't you?
Me too. I spent half the time leaning against the back grill back there. Yeah, I know. We should be out with the employees and stuff like that. I mean, it's nice to see them come through the line and stuff like that, but they're going through so fast, you really don't get to engage them. So we're going to talk about doing that.
Another big reason for that is the burden it puts on the kitchen staff.
Yeah.
So many times that these events are going on, that if we're back there serving, whatever, I understand that's a good
They don't
thing to
get-
do.
or they're keeping
But they
up.
don't, they're the
Right.
ones keeping up.
Oh, they're
going.
doing all the work.
So they
Yeah.
need a Christmas party too.
Yeah.
Right. So that's kind of the idea.
Good.
And then last thing, just, again, we're been searching for a couple of new ED positions. And Mark and I and Dr. Hall have interviewed a couple companies for recruiting and so forth. Scott, I sent a contract to Scott to take a look at. And he just gave me his responses back on that. And so that's gone out to the company to see what their legal side will say. But yeah, we've got probably 2 or 3 that we need to, again, some of our staff are getting older and so forth, don't want to work as many shifts and so forth. So we're ending up with empty slots and so forth. And so, or others are just picking this up and we really shouldn't be, So that's what we're going to do. So just to keep you apprised of that process is underway. So Dr. Hall's been great about trying to beef up the quality of the positions back there and everything else. So it's nice working with him. That's my report.
I did have a question, Catherine.
Yes.
Back to that TRICARE one.
Uh-huh.
Now, is that the agreement that we've been trying to get in place with veteran services?
No, that one's still trying to figure that one out. I put a call into them to see if we can't just set up a separate meeting. We don't need to wait for the breakfast to do this. We can just do this online. Sending it back and forth.
Okay, so that one's
So
still pending.
That one's still pending. This is for the other retayees.
All right.
And so forth.
So would that possibly an incentive to get them, since this is veterans related?
I'm
perhaps?
hopeful.
Okay.
Yeah, I will share that information when I talk to them. So just let them know, hey, we're still committed to this community, and so forth.
So the thought about, doing like a draft contract, or at least a component of a contract that outlines the services that we're capable of doing.
Yeah. I'm not against doing that. Again, I need to spend some time with Greg, just to kind of go through how we outline what those services are going to be, availability and those kinds of things. That's what we've got to figure out.
Okay.
Like I said, I know we're seeing some of those people are coming through our clinics now, and so forth. And so, but we'd certainly love to have the VA's blessing behind that, obviously. So,
I mean, it's just a way to start the conversation and move this down the road.
yeah.
Because it's been pending for so long. So can we make this a formal referral to
Yeah,
you
definitely.
and have you report back in a month?
You bet. Absolutely.
Ross, the TRICARE takes care of the veteran and their family.
Okay.
The VA
Yes.
that he's
Not just
referring to is
that.
just the vet,
Yeah, the VA and TRICARE are two separate.
So,
totally separate.
So I don't know how do we have to vote on that? It's not on the
just
agenda,
the
but
direction to me
just-
is,
okay.
and as long as the rest of you are okay with that.
Yeah.
Okay.
Great.
And I'd even be willing to see if they would, of course, I mean, it's up to you and Greg, but like, we've talked previously about utilizing the mobile clinic, maybe you could go to the VFW once a month just to do, checkups or
Screenings,
shots, those
things
kind
like
of
that.
things.
Yeah, definitely. Okay.
They're always telling you to hurry up and wait in the military. We could take the bus down there and unman it So they,
So bad.
That was bad.
Well, you know, Gene, I know that you fought in the American Civil War. Before there was a fiat.
Did they have medical insurance then? Just kidding.
in the Civil War,
Yeah.
Ambulances were horse drawn.
Right.
Chickens.
Thank you, Tim.
Thanks.
You got it.
That's funny. Okay, so no old business. New business is, number one is this, security services discussion about job description for lead security officer and security officer position. That's pages
what is it, what page?
4551.
Ross had asked for a pro forma, I think at the last building and planning, right?
It was at our committee meeting, the personnel,
Oh, okay, 4 p.m.
because you were getting the job
So-
description of
So
it.
we were able to put together a fairly accurate, I think, pro forma. I mean, we assessed even down to the linen laundering and costs and stuff. So what you see there is the current rate that we pay for security. The first column, 26. The total in hours per month is $18,720. The proposal that the owner of the company gave us was he wanted to raise it to 33, which brings us to about 23,760 a month. And when we started looking at managing this program on our own with a lead security guard and then staff to continue at 24 hours a day, 7 days a week, we think we can do it for much less, probably to the tune of $5,000 a month less than what we would be. on the proposal.
$8 more than what we're paying today.
Right. So that's, I guess my sense is this is something that could be managed in-house. We can get the uniforms. We've already kind of looked at them, what Sparkle provides, and do the laundering that way.
Mark, did you figure the cost of the work comp?
We're it's just gonna be, they're gonna be employees, just
It's
like
gonna be
anybody.
free, we're gonna,
No, I put
We're paying for
benefits.
the
I put 20% benefits in.
We
there.
did put the benefit
Benefits
package
are
in there.
I also
That's added in.
contacted Beta to see if we need additional insurance. We do not.
but we're paying for it.
No different.
Okay, so we're not paying. If they're an armed guard, it's very expensive.
Yes.
Right, and that's exactly what they said. If they're armed guards, we'd have to get additional insurance, but since they're not and they're our employees, they're covered under the current policy.
Is this gonna be new employees?
Yes,
Now, who's gonna be managing them?
there'll be a lead security guard. And then right now, they report to Bob Easterday. That person would report to plant operation or plant.
Is there gonna be any cost? Is that all free?
It's all current, it's all.
It's all, there's no extra cost. The cost that you see here is what is gonna be the
But the
cost.
time that the manager's taken to manage that, he's taken away from something else.
That is true, yes.
I mean, so
And
it's not,
that's why we have a lead security guard to manage the scheduling and
and the chances of us screwing up so we don't know what we're doing is great.
well, we've done this for 30 years before we started with night security.
With security.
Yeah, we've had security in-house all the time. It's just like I said, we went back, I can't remember how many years ago it was now, 3 years ago.
Probably 3.
And,
During COVID.
huh?
During COVID.
Yeah, it was during COVID, right? And so we just gave it to them because it was easier for them to do that. So, and again, we wanted to focus our people on working here. So the bottom line basically is, yeah, I mean, these will be new people. But a lot of the people that are interested in the positions are people that are currently working for this company. So they all have guard cards, that the ones that we've seen so far, they all are training, everything else. So
My thoughts would be better off to try to figure out how to run the hospital. But that's just my opinion.
we'll keep working.
Anybody have any questions? No, no one else?
I did have a comment. I just
Okay, go ahead, Ross.
wanted to thank Mark and John for putting the numbers together.
No problem.
That
Yeah,
having that in front of me makes a lot easier decision for me. I have concerns like Gene does about the hidden costs, their manager's time and whatever else things might crop up, but this certainly looks attractive.
One of the things that most likely will happen, like I say, why right now, like I say, 'cause it's currently kind of overseen by Bob.
Okay,
I will most likely have, Mark and I have talked about him taking that on. It's, like I said, he's done a lot of the work before, he's obviously met with the employees and so forth. And, so, there is that opportunity because it's, we discussed in prior meetings, Bob looking to maybe give up some of those other duties and so forth, so we can focus on construction. So
Right,
that's why we're trying to migrate this over.
okay, all right. Well, I'll make the motion to approve. I'm sorry.
No, I was gonna say, do we need a motion? You
Yeah.
just answered it.
I have a question. So, and what does that do to your workload if it goes to you?
So I've kind of been in contact with one of the security guards who we would probably use for that lead role. He's applied for that. He's one of the ones that is probably the most qualified to do it. He's got the right mentality. Everybody likes his interaction with everything that's going on. And so I don't know that there would be a lot that I would have to do except for performance evaluations and things annually. If I have to contact him because of a problem situation, that might take a few hours of my time, but I don't see I'm not going to be writing the schedules or doing any of that. So, and that's a big part.
Yeah, and the reason I ask is because as we continue with our building program and everything else we have our hands in, that I don't want to continue putting more on our managers
Right.
or administration that backs us up where they're not able to complete what we've already want or need.
Oh,
So
understood, 100%.
just want,
I think that this is the kind of situation that I don't anticipate a lot of hours of my time. That there are a lot of hours that are taken up in my day, but I can certainly shift some things around.
okay. So we have a first and a second.
I don't think we have a second. I'll second.
Oh, I thought I heard a second. I'm just hearing things,
I
obviously.
was going to make that comment.
So just
Sorry.
one more comment. We're good with night security through the end of the year. So this
Okay.
won't start till January 1st.
Okay, but it should be in place, ready to go at that time.
That's kind of what we're trying to get done.
Okay,
Well, us taking his employee, is that an issue, Scott?
No, actually in this contract, there's no
Okay, okay,
No clause.
Good.
clause in there.
Yeah, it was the first thing we looked at.
good, thank you.
okay. So I have first and a second now. Thank you, John. So, Fred, your vote?
Yeah.
Jean, your vote?
I'm not in favor of it. And it's gonna pass anyway, but I just think it's more trouble than we should. We're looking at maybe saving $60,000. It's all blue sky money. It doesn't seem worth the risk to me, so I'm gonna vote.
Okay.
Yes.
Yes, I missed that for some reason. Ross?
Yes.
Yes, and I'm a yes. I do want to say that as it's passed, thank you for everyone. And Jean, I respect your vote. I just hope it doesn't, I just hope we can go forward with it and that it works out. So,
So I think that just to bring my thoughts into it, we were looking for a security company when we found Knights. And if it does get to be too burdensome in the future, I'm sure there's another program out there that we could look at. I think you're right. I think during the building project, I will have a lot of irons in the fire to keep up. But, if the right guy gets in place to be that lead security guard, I think we're fine.
Could we put in there to review after 3 months or 6 months so that we don't sort of let it go by?
Sure, we could do that. Yeah, we could.
Would.
We usually do stuff like that anyway. In our own management of
Yeah,
the.
but I would like to see.
But we can bring it back to here to say this is
6
how
months
this has happened.
And if that doesn't work out and we bring Knight back, we'll be paying them more, just so we all.
That's probably true.
We're under the minimum
I'm sure.
hospital wages, right? That minimum $25 or.
So the minimum wage right now for the hospital, Tim, if you would, what's the minimum wage?
$18.
$18. I think the minimum wage is 16, right? Or is it 18? It's 18.
We implemented it back on, June first.
June 1st.
Right.
So these guys will come in a little bit higher than that, just to keep them off the bottom.
So that's our hospital. The other hospitals are 24 or something.
They're 23.
23.
Yeah.
Okay, now how does he get his figure, what he's paying? Is he?
He accelerated the $25 an hour immediately. That's where we got
So
that
he has
$33 number.
He has to pay what he thinks $23 minimum wage is what he's thinking.
His thought was he was gonna pay his guys the $25 an hour.
Right.
And he wanted $33 an hour to cover his administrative costs.
Right.
But does he understand that he don't have to,
We
He
had
would
him
have
in
to pay-
Tim's office talking to him about
we
that.
did.
he would have to pay what we're paying, 18 minimum wage,
Right,
right?
right.
Okay,
Technically, it applies.
But he was gonna still collect 33.
yeah.
That minimum wage
Nice.
law mandated that any contractor that works with us has to also pay their people $18 an hour.
Same.
So that's why it would apply to him.
Right,
Right, so
But we got it separate from the normal statewide 23.
ours will go up.
Okay.
3.5% per
Yeah,
year.
yeah,
in 10
annually,
years,
right.
and we get to 20.
Could
You
we make it 4.5% or 5%?
want to get there faster?
Yeah.
I've taken it up with my CFO.
Let's wait for 3 or 6 months and see how we do first.
Yeah.
I'll bring you back a report in 3 months after.
Okay, so Ross, are you gonna modify it to after 6 months or what? I mean,
Your choice. You want me to do a 90-day, January 1st?
A 90-day just discussion, it's not a big deal.
Yeah, no, you do them one.
Yeah.
Put it in my report?
Yeah.
Absolutely.
Then you always put a clause in there that you can get out with
Do you want to change your vote?
90-day notice.
Yeah.
Just kidding. Okay, thank you. Any other questions on that?
So just for the record, we already voted on this,
Yeah,
and
right,
approved it,
right.
Yes.
and now Gene wants to do something.
No,
different.
yeah, you're right. I
Okay,
was talking about after the fact.
and it could be,
Maybe put it on the agenda 3 months out.
yeah, it can just be a
Right.
referral to
Okay.
him to
On
bring
the
it back.
April
and-
agenda.
Okay, okay,
I'll mention.
cool, thank you. Yeah, I'm sorry, Russ, you're right.
Twice in one meeting. You want to,
Especially after I voted no.
It happens.
it does happen, it does happen.
Ask him one more time, Kathy. He'll say yes.
You're wearing them down.
I'm wearing them down, I'm trying.
I voted no a couple of times and the only odd man out.
Yeah.
Yeah, I
That's
got
okay.
two.
I wrote all of those down.
Jeez. Okay, so let's go back to, on the new business, number 2, the Zero systems. Zero knows.
Cerno Day Burge, right?
Yeah, that's what I
Yep.
said. I didn't say it right, obviously, but. So, is that you?
Well, that's Debbie.
Hey, Debbie.
Debbie.
I can help.
Debbie,
Debbie, come
is
over
the
there,
one-
I can see you.
you're the one that's paying for that. What are you doing? Why are we paying
Okay.
$500 a
Go
month?
back to the strategic plan that we did several years ago. One of the things that we came up with was communication to the employees and outside of the hospital. So we went with Cyrano, and it's a bid, they do video editing and a lot of different things. Originally, we were gonna have, the thought was that administration would do a video once a month to the employees for an update on what's going on, just a short 3 to 5 minute video. And that never really happens, but we use it for marketing. Tiffany does once a month video on nutrition. Grace used to do once a month on physical therapy, which we're gonna have Lindsay start doing that. So we use it for some of the videos that we send out on Facebook, behind the mask, doing that. We're gonna change that program for 2025. So that's what we use it for.
Okay, it just seems like $500 a month. Everything I see on Facebook, people, they just take pictures, or videos, and they're real and they're honest and they're not produced. I
Most of what goes through there is our people just talking in front of the cameras and stuff like that. There's very little production, I think, that's being done right now. There was, I think, initially when we first
So we're
started.
paying $500 a month for that every month.
I know.
And
And they get some visits out of it though.
yeah, if we use it and if we're using it right, is there a better way?
Yeah, you can show this is one that Tiffany.
I'm
does.
making sure I'm
Is that
showing you.
Tiffany, Tuesdays with Tiffany?
Yeah, so that's one of the things. So this produced, you're right, it does look produced, like background and stuff. That's from Cerno. I'm gonna preface this before I started. I'm not 100% sure this is a Cerno video or not, but we'll figure that out. The 5-minute videos. Yes.
Yeah.
Okay. I was hoping everybody would say that.
Yeah.
There's the popcorn.
So a lot of it is like the intro, the distribution of this to employees and all that.
Rather than me knowing that we had to pay to have that done, just like in the recent election where they paid $1 million for the background for stuff and it got them zero. It got them less than zero. It got them a big minus. And so I think it would be better off if we just did a simple one and put it out where she's just there and honest and telling what she's doing.
I don't necessarily disagree with you. I mean, this whole thing, like I told you before, we've discussed the value of this in the
Okay,
past. So
we should, if we could, let's look at maybe improving it and
So let's, me, Deb, and Netta will discuss the value of this program. If there's something beyond my limited understanding right now of all that we may be using it for, and if it's something that we can just do in-house and keep the same quality and production and all that without it.
homemade nowadays is better quality.
Well, we do have some, I mean, Netta's very good at graphics and stuff like that too. So there might be the opportunity there, but
Okay.
I gotta understand the
that's all.
contract, if we
That's
can
all.
even get out of it.
Okay,
We might be in something, there's a lot to understand, but we'll look at it.
okay, so you guys, if you'll look at it, that's all.
We have a recent one that we did in-house, correct? That the ad we did for the
Yes.
SNP. That we could show you maybe at the end of the meeting. It'll take them about 5 minutes to load it up and stuff like that, but it'd be nice just to see.
If that's what you're talking about, I do.
I'd like to see that.
Yeah.
Yeah, that was pretty.
Was that through Cyrano?
No,
No, this is what we did ourselves.
Okay.
Good,
But
Okay.
just to Gene's point,
Yeah.
right.
Right.
Now, whenever I do an ad like that and I send it out, I get so much response because people look at it and they say, this guy needs help. And so
So Gene, when we started this, we didn't really have the skills in.
I know. Well, let's look at it if you.
Right,
Debbie.
yeah.
You
No, I
guys
agree.
see the skilled nursing. You guys are-
Yeah, take.
Yeah, I saw that one. It was
You
really
want to
good.
show it? Yeah.
If this is what everyone wants to see.
Yeah, let's take a quick look at it. No, it's a short one.
It's only a minute.
Beautiful.
Yeah.
It was a good image, but I didn't get as much. I couldn't read the whole damn thing all at once, but it did create a good image.
This is an edited one.
This is not the final draft.
This is a final draft. There is a different one that we're going to be distributing, as we've talked about before.
Yeah.
We're
So-
segued into something completely different here, but that'll be distributed in like the Southern California region to let them know that we're here and we have beds available. It'll be
Yeah.
very, very similar to that. But like you're mentioning right now, some of that text is a little bit fast to read. We've edited that to be a little bit more digestible
Don't edit
in the
it.
moment, yeah.
Slow enough to where I could read it.
Yeah, not that.
Well, you know what they do is they run it by me, and if I can't read it, that's why we
Yeah.
make changes.
But we always do it at 0.5.
It's true.
The only thing I'm worried about is
Yeah.
it's gonna make people not want to get older. And so.
We'll be out of business.
then they can-
Well, the beginning of the video says, deal with it, it's gonna happen, and then.
And then it speeds up, so you can.
But music builds, that's right.
Okay,
Okay,
so we're gonna find out where this
Thank
But yeah, this is
contract
kind of
is.
what you're
Looking into
saying.
it.
we'll look into it. That's the,
Okay,
yes.
So the Cyrano contract then isn't approved? You're gonna bring that back at the
Well,
next?
it's
meeting?
been approved. It's been on there for years.
So the contracts,
It's ongoing, yeah.
we review the contracts annually, whether that contract expires in 2 years or 3 years or whatever. I don't know when this.
Well, it was
contract-
on the consent agenda for some action.
It's a year-to-year contract, and I think it's up in January.
Okay, so this is our heads up to deal with it?
Yes, sir.
Yeah.
so we'll bring it back next month.
Just to table it.
Or,
Or
you
you
know,
want-
they're wanting to use it. It's okay, but they're gonna look at it.
But let us know next month.
Okay.
We'll let you know next- yeah.
See if we can.
Which way either recommend that we don't continue with it or
Or
we should.
even 2 months from now, so they don't, I mean, it's,
Well, it's gonna be up in January. We need to either know ahead of
Okay.
time what we're gonna do.
Yeah, I don't know when it's up.
So
Okay.
according to the chart in the package, it can be terminated on 30 days notice.
Okay.
Right, so we can do it anyway.
Well, hang on. Christine just said something important.
So they send these contracts out for review 90 days before the expiration.
Yeah.
Well, 90 days before its anniversary, so it can be evaluated in this manner, and you guys can make a decision whether or not to continue it. So it would be January that it would be up.
So
well,
we can
we don't want to push them.
Thank you, Christine.
And that's one of their tools, and it just seems like there's better tools now. And it's been, what, 3 or 4 or 5 years?
Oh, yeah, you're right. The tools have gotten much better.
So, yeah.
Absolutely.
Yes, the effective date is February 1st.
So I'm guessing
That would
that
be
if
the
we can
renewal
get the
date.
answer back at your next building and planning meeting. at
That'll
that
give us
point,
time.
Make a decision, and that
Okay,
gives us
we need-
plenty of time to notify.
Yeah. Take plenty of time. I mean, it's been in there for that long.
It's not that big a deal to look
Okay,
at and come
okay,
up with an answer.
Okay,
No
cool.
big deal.
So at the next building plan,
That gives us time.
All we got to do is look at the contract. I think it'll be fine.
Okay,
By the time
30
we
days.
post the agenda, it may give us less time, so the next board meeting would be better.
Okay.
But if it's 30 days notice termination,
Yes, it's.
it doesn't matter.
Yeah. Right. Thank you.
do they give
When you talk
people
with
the rights to
Tiffany.
everything that went through them?
You know, this was a 2019 contract, and I have no recollection of what it says about that.
I'm sorry, about what?
Do they get to keep the rights to everything that went through them? Do we have to pay them a royalty or anything? Or-
It's our content.
Okay, so we own it. Like our engineering company, which they own everything we paid them for. Bob's not here, is he?
We should own it.
No, we don't. We can't use anything in there.
It's talking about Greenbow.
Agreement.
I'll have to look at that contract.
Architectural plans are specifically the work product of the architectural firm or used by the hospital, even though
All contracts I write, the client owns it.
Yeah.
Not the
we'll
architect.
go back and take a look
Okay.
at that. Right.
Because he said this year, and I was here, he said we couldn't, we can't use it. He said he might get permission.
Yeah,
Okay, well, we'll bring that up and
we'll look at that.
Okay.
Cool. Got that, Heidi?
Yeah.
All right. So, we're gonna go ahead and move on to H, which is the director's comments on items not appearing on the agenda. Yes.
No,
So are we just tabling because it was on consent?
Yeah, but
we
we
can take it.
moved
well, we
it, so
took
we
it off
tabled
consent,
it.
though.
Oh, okay.
Yeah.
Building.
And
Oh,
moved
okay,
it to
okay.
No, next board.
Come on.
right?
next one.
Next board meeting, not building and planning, Ross.
Let me rewind this.
Oh, I heard building and planning.
Well, and then,
I said,
Building and plan, we're going to place that agenda next week, so it gives them just a couple
I
of
see.
days.
Okay.
And we'll do the next board
and
meeting.
since it's,
Heaven forbid we work that hard.
Okay, and we are meeting in December? It's like the day after Christmas or something?
We can adjust the days.
Okay.
Yeah, you normally do adjust the dates.
and since it's a 30-day to, stop the contract then.
We'll figure it out.
Okay,
Okay.
good. Thanks, keep me on my toes. John, do you have any, comments?
No, nothing in particular. I know that they're still counting votes. I heard him communicate a couple of times about it, so, but we just won't know until they officially certify it.
And who knows with California?
They have until December 3rd for the county to certify. The state has until December 31st.
Oh, okay. Good.
So, yeah, so we should know by December 3rd.
Okay, for anybody who don't know, my son is running too, and he's back and forth. And he's gonna want to recount, so that'll take another year.
That's probably not a joke.
But, no, it's been interesting to seeing the local election, the back and forth between Gene Jr. and I. But I did want to say, so I was in New York when I saw that one of the gentlemen that used to come to these meetings, Jim Diesel, he went on Facebook and wanted the 5 candidates to do. Of course, 3 of us couldn't because it becomes a Brown Act issue.
Right.
And we used to do those kind of debates during an election, which they were very spirited and had some good opinions. But I did just want to say, even though he came up as last in the election, Albert Landry, I saw some of his comments, and actually I agreed with some of his comments, particularly with the behavioral health, which I know we as a board have been discussing about. But I just wanted to say I thought that he made some valid points about that, and even though he probably will not get elected, if he wants to contribute on behalf of the high school some opinions to Tim or the staff, how that might benefit us as a healthcare district, I'm in favor of that. So
Happy to talk to him.
anyway, that's all. Just an observation of the local election.
Ross?
I don't have anything to share today.
You
Thanks.
don't? Jean?
Congratulations to all you guys that got re-put up. You guys are all good board members, even Fred. And so
Yeah.
you were supposed to laugh.
Even Fred.
But,
Fred, any comments?
Formally take a vote on pricing, bring it back to the board after the elections.
Oh, in terms of which
We need to react on that the first part of December, so we might want to see if that needs to be done before or after the next board meeting.
Okay,
Yeah, we'll need to find out because otherwise.
We might have to have a
Roll over.
special meeting.
we may be able to do that until.
We could do that.
Election, good job.
I don't know what Tricenten's timeframe is.
I'll call him and find out.
we can be more aggressive now that Trump is in charge.
Yeah, and our FEMA money is probably gone.
Yes.
Thank you. And I do not have any comments. I usually make them throughout the whole meeting, so.
Not the fact that you were number 1, the results.
Oh, well.
That's cool.
This will be my second time at the top. Now, the next time, I don't know. And they're still counting, so she could be
Yeah.
Gene Junior. Just kidding.
That's only because.
I
he was
voted a lot of
campaigning in
times.
front of bonds with dogs. That's.
You know, I did not take my dog in front of ponds.
Yeah, the table's set because I saw you out there
That's good. That's good.
harvesting.
That's really good. Okay, at this time, it is 2:55 and we're going to adjourn this meeting while we do closed session.
So under Greenville, we own the just.
Oh, good.
What do you do?
Long.
Okay, we have completed the closed session. We are back in open session. It is 3:14 PM. Then I have Scott do the closed session report.
Yeah, Risk Manager Griffith gave the medical quality report. Council updated the board on Vincent, Volkova, and Rostad. And for the performance evaluation, the board tabled that item to the next building and planning meeting. No other items were discussed and no action was taken.
Thank you, Scott. That brings us to the adjournment of, the
Motion.
So do I have a second? Let's move on. Thank you, and it is 3:15. Thank you very much, everybody. And I don't have my glasses, so I'm really